afternoon, and welcome to the Dr. Fazil Show. This is our February 2021 edition, and today we're going to be speaking with Dr. Fazil in regards to 2021 COVID-19. Where are we headed? Do we have any other treatments? How is our vaccine coming along? And other details that he could share with us. Welcome, Dr. Fazil.
Thank you, Wendy, for having me on this show, and the audience for watching this show today. So, as Wendy said, the topic for discussion today is, as we know, we're in 2021. 2020 was a rough year, as we all know, and we are hoping for a better 2021 as we have more arsenal in our tools to fight this deadly COVID-19 infection. So today we're going to be talking about the epidemiology of COVID-19 infection. Unfortunately, one death is too many, as we know that. But so far we have 455,000 people died in USA alone. More than 27% of US population which has been tested positive for COVID-19 infection. So it is a global pandemic. Unlike flu infection, it is not seasonal. It was here in summer, as we thought it was going to go away in the summer. It did not happen. And also, it is mutating fast. So that's one of the things. One thing which is obviously good about it is that it's not deadly yet. Hopefully it remains as it is, but we don't know about the future. It is very contagious. It is more contagious than, it's 3 times more contagious than the flu infection, but it is less deadly as compared to I keep giving example of flu because that's one of the most common core viruses we get. It is less deadly. Now people do ask, how come flu is more deadly but we get less fatalities from flu than COVID? The reason is very simple answer. Because it is more contagious. So you have more people infected. So let's say you have 7 billion people in the world, majority of them has been infected, then 7% infection rate of 7 billion is a lot. So out of that, even though the mortality rate is less, but is affecting a bigger segment of the population, we see a lot more casualties than we see in flu. The other thing we see why it is so contagious, because in a lot of other infections which are very deadly, the virus needs a host. If the host is dead, then it wouldn't spread anymore. Like for example, in Ebola infection, or in the medieval time, bubonic plague. So it's kind of have a stopping process. It stops because it is deadly. Since it is not deadly, it doesn't stop because people get sick, but then not a lot of people die. Although we said people have died a lot, but we have to look at the bigger picture. Since this is affecting a lot more bigger segment of population, so obviously even though the mortality rate is less, we see a lot more fatalities.
So and the again, virus doesn't want to kill the host, it wants to keep the host going so that the virus can continue to grow and mutate.
That's exactly what it is. That's exactly right. Because it is staying in the host, not killing it, but it also giving him a chance to mutate. And virus mutate very fast. Unlike bacteria, which has a slow reproductive cycle, virus replicates very quickly. And there needs human cells or living cells to replicate. So as long as the cell is alive, it's good for them, so they can keep mutating it. So it is both, we call it good, bad, and ugly, because it has up and down. Obviously, we got some tools now, as we said. We have treatment options, we have vaccination, and hopefully that will help us to control this piece, or the genie which is out of the box.
And Dr. Fazil, we've heard there are different vaccines available, the different pharmaceutical companies who have created those vaccines. Can you give us a breakdown of each of the companies and what the differences are?
Yeah, so Before we go to this topic, I think we need to emphasize again. While we are shooting this show, we are following the CDC guidelines for the COVID-19 prevention. Besides that, we do advise all of our patients and audience that they should wear masks and hand sanitization. That's the key. I mean, that's actually more than anything else. And the reason is that as the vaccines are coming in and the virus is mutating, we don't know if this vaccine might be 100% effective or as effective as they're supposed to be. If the mutation happens, which is happening, we know we have a UK strain, we have South African strain, and America have its own strain. And these are like a UK strain, like South African strain is 70% more contagious, not deadly, more contagious. That means you can get it 70% time easier than the earlier version. So one concern is that this vaccine, which we have from 3 different companies, is Pfizer, Moderna, and Johnson & Johnson. Johnson & Johnson is not, at the time of this show, is not approved yet, but we in February 2021. So hopefully, hopefully this month it will be approved. So the efficacy rate of, the pros and cons, as you said, the question was pros and cons, right? So the Pfizer, it has to be kept at ultra cool temperature on minus 70 degrees. Moderna, you have to keep it minus 4 degrees, so it is easy to manage. But both of them need 2 shots. While Johnson & Johnson, you can keep on the regular temperature and it is only 1 shot. Although the efficacy rate for Pfizer is quoted at and Moderna around 95%, then you take 2 shots. With 1 shot is 170%. With 2 shots is 95%. But Johnson & Johnson, since it's only 1 shot, is only 70%. The technology is different in each vaccine. The Pfizer and Moderna is using RNA genetic code versus Moderna is using weak virus, which we have already, seen in the past with other vaccine. They use the same technology. The Russian vaccine and the Chinese vaccine have the same, the way of action. So I think the time will tell if there's any side effects or if there's any, more better protection from the new mutations. We are hearing different views. I read one article from where the Pfizer is saying that we might need a booster shot after 2 shots. The new strain come in, but people have said that it might still give you some immunity, if not as much as it says for the original strain, 95%. So again, we're going to go what we have, and what I tell my patients is go ahead and take the vaccine because there's nothing to lose, and then some protection is better than no protection, and keep using the mask. Now, as a matter of fact, they're saying double up the mask, and there's two different school of thought. Some says it's bad, some says it's not bad. The reason they're saying is if you put 2 masks, it might cause air to flow from the sides, and that's where you get the infection from, or give infection to if your front side is too tied up. So again, at this point, we have seen the mask and the hand sanitizer, either you wash with the soap or sanitizer, is a key factor. Vaccine would probably, and we have seen in last few weeks, it has decreased the epidemic of the COVID pandemic. Hospitals have less admissions at this moment. Now again, this is based on like 6% of US population have got vaccination, at least 1 dose, and then even with 1 dose they get 70% protection. So there's some
protection out there.
Some protection out there, plus people are saying, hey, why we just go to single dose and not worry about second dose, and we can double up the speed, and that might be a way to go at this moment. But in few months, if we have a lot of vaccine available and FEMA is involved now in distribution of the vaccine, then it might be a moot point. So I think we'll have to see in next 3 months. We came that far, 3 more months wouldn't wouldn't be. I know that people are having COVID fatigue. They are being kind of tied down in their homes because of the fear of getting COVID, and so I see another underlying pandemic of mental health issues. Because of various reasons. Lockdowns for businesses. Being not able to do what they used to do in the past socially. That is causing a lot of anxiety. I call it COVID fatigue. And we see a third wave, which is, people are not able to go to the doctors, and they're missing their routine checkups, which like cancer screening, mammograms, pelvic exams, prostate exams, those kind of things, colonoscopies. So we can miss a lot of things. Or people have other medical conditions like heart attacks and strokes, and they're not able to see the doctors or wouldn't see doctors or ignore the warning symptoms, and that's also causing mortality in addition to COVID. So COVID by itself, then mental health issues, then underlying comorbid condition besides the COVID, and then obviously the financial strain and the ramification of financial strain, like somebody lose their job, somebody lose their house, not able to feed, being on the street. Obviously they're going to catch more other medical conditions which we don't anticipate.
Thank you.
Now you can catch up with all of our previous shows on all Roku devices. Simply search for the Dr. Fazil Show channel and add it to your home screen. View our videos online by visiting our website at www.drfazilshow.com. Our videos are available on YouTube by searching for The Dr. Fazil Show. And don't forget to subscribe to our channel. The Dr. Fazil Show is available in multiple provider office waiting rooms across Yuma, Arizona. Don't forget to get your copy of Health Tips magazine and read about this interview, currently distributed across Yuma, Arizona.
Okay, so Dr. Fazil, you're encouraging your patients to get that COVID-19 vaccine as some sort of protection there on there. Have you received your vaccine?
Absolutely.
And how did you do with it? Did you have side effects? We've heard so many horror stories about some people having side effects.
Yeah, so I took Moderna vaccine. I didn't have any side effect. There was some soreness in the arm where I got injection, but other than that, I'm still here.
And have you had your second vaccine yet?
Yes, I did.
And were your symptoms about the same, or were they any different with that second vaccine?
Second vaccine have some symptoms, and as I said, you probably want to have symptoms, because if you don't get symptoms, probably the vaccine is not working. And the reason is that the way vaccine works is that it causes immune response, the same response or same symptoms or mild symptom what you would get as a COVID vaccine. A COVID infection will give it to you. And we have to remember that this vaccine are very sensitive to the heat. So in the supply chain, if from manufacturing to distribution to inoculation, if they lose that temperature control, it can cause destruction of the vaccine. So once you're on the room temperature, the vaccine works on for 5 hours. So this genetic RNA vaccine is not something new, but it has never been able to be utilized in the past because of the it is very unstable, when you try to use it because of the temperature issues. So what they have done this time is they have used nanoparticles, which people think it is some kind of like a bugging device. And again, trust me, it is not. It is probably another hoax which we hear all the time. So it is not. That's actually a nano liposomal particles which actually protect the vaccine from destruction of the heat. And that was the first time they could actually do that and use this new technology, which was rapidly approved because it's easy to make this vaccine than the conventional vaccine. So in a pandemic like that, we had to break the sound barrier to get what needed to be done in timely fashion, because we didn't have time to have 5 years to kind of like check all the bells and whistles. So that's why it was used. But the innovation was that they could actually come up with this new technology where they can stabilize this new novel technology and utilize in such a short period of time. Then see how it works. How the Pfizer and Moderna vaccine, which has the messenger RNA genetic code technology, works.
So how are the Pfizer and the Moderna vaccine different from the Johnson & Johnson and the traditional vaccinations that we have seen in the past?
So, Wendy, the Moderna and Pfizer have used a new technology known as messenger RNA. This is a slight genetic code which get injected into the muscle of the patient, and it goes to the ribosomes, which are protein-making factories inside the cell. So, cell you can imagine as an egg. You have a shell, you have a yolk, and you have a white of the egg, right? So that white of the egg have, that's what we're talking now. The shell is like a membrane, so it injects through the shell into that little white of the egg, and those white of the egg have little particles known as ribosomes, which make proteins. So in normal circumstances, then messenger RNA comes from the yolk of the egg. The yolk of the egg, and when somebody attacks the shell, it injects certain kind of message to the nucleus, which is the control center of the egg, and it produces in response to that attack a code which goes to those proteins making factories which are floating inside the white of the egg, and they produce defensive proteins known as antibodies, and they or some kind of protein which goes and goes to the shell of the egg. When our antibody mechanism, which is different than what we're talking about, the different kind of cells, when they see that, they produce antibodies from our lymph glands or lymphocytes, and that antibodies are there as a standby mechanism. So if the real enemy come in, which is COVID-19, it can neutralize that attack before it attacks the cells. So this is how it works. In traditional vaccine, we give the live virus or dead virus. It goes to the cell, and then cells perceive that as an attack, and they produce. Then they produce messenger RNA. Then they produce, proteins. Then they go to the shell. Then they go to the immune system. So this is actually bypassing a lot of steps. So it has a little bit more advanced technology, and also it was easier to make in a shorter period of time with less restrictions. So I think with those two factors in mind, those were utilized. Now the side effect, so far we haven't seen much. We have seen some allergic reactions, but you can get allergic reaction with even Tylenol. I mean, if you're giving in a massive scale, we do expect side effects, some allergic reactions. So that's not unique to this vaccine. That is unique to a medication in general. So, people which have more prone to a lot of allergies, they probably would have allergies to this vaccine. But people who have no allergies, it doesn't mean that they would not have allergies. So we have to watch for allergic reactions, but they're not very common.
So once you've had your second dose of the vaccine, are you 95% protected as of that moment, or does it take a while for those proteins to develop in your body?
It takes a while to do it. It takes a few days. I mean, obviously it has to go in there, cause the whole chain reaction. We're talking about a few days, not weeks, but few days for it to fully effective. So yes, it will not protect you right away. That's why we're saying keep using the mask. And there's a reason for that too, because if the new strain come in and that is not effective, or is not as effective as it was for the original strain for which the vaccine was developed, then you can get complications or infection.
The false sense of security.
Yes, so it might actually be counterproductive that you were putting mask, then you got the vaccine. Now you thought you were protected, and then you took the mask off, and now you have vaccine. It didn't work for whatever reason. It might be new strain, or the vaccine was not as effective as we thought it was, or somewhere it got.
You're part of that 5%.
Or it got the temperature was not controlled on distribution chain somewhere, and it didn't have that much protection as we thought it would. So till we call it is not over till it is all over. So
Correct.
That's the plan.
So once you've had the vaccine as well, can you still be a carrier of the COVID-19 vaccine or virus?
There's no carrier state in this virus. I mean, once either you have it or you don't, because it's once you have antibodies, it's not only protect you but also kill the cell at the same time. So unlike we see like in hepatitis C or B or HIV, people have a carrier. There's no carrier state in this condition. If you have it or you don't, this is no carrier state.
Okay.
I know I know where you're coming from. Like, okay, if you get infection, you could carry it before you get full manifestation 2 weeks prior to that. That's why they quarantine you for 2 weeks, because you don't have symptoms. And again, then it goes away. I mean, it's not going to be there for lifelong.
Okay.
So either in 2 weeks, either you will have symptoms, and then in the next few weeks it will go away, or you will be sick enough to go to the hospital, or it will go away by itself without causing any symptoms. So you don't carry it for lifelong.
Okay.
Yes. And the reason is probably the body has produced antibodies by that time, one way or the other, because you get antibodies produced either from vaccine or from the real infection. So if you get real infection, two things are going to happen. You will have no symptoms, or you will have symptoms. Either way, you will develop antibody response, which is good for 4 months at this time. That's what they say.
Okay.
The reason they're saying 4 months because of the new mutations which keep coming in. Then the question arises, okay, if it is real infection is good for 4 months, then how the vaccines are are good more than 4 months, which is defeat the logical thinking. And that's where we are now. So this is the straight news, so I cannot give you twisted facts. My understanding is based on my medical knowledge and research that we might need booster shots. The only way this COVID-19 virus can go away is that mass inoculation, where a lot of people get inoculated at the same time, so virus doesn't have chance to mutate, and then obviously protecting more new strains to come into the country, like UK virus and South African virus, because if you protect everybody else, but then the new strain come in, it might not be the people might not be resistant to that new strain. So I think relatively keeping travel restrictions with mass inoculation at the same time is the key at this moment for the United States. And also keep using the mask and hand sanitization.
Now you can catch up with all of our previous shows on all Roku devices. Simply search for the Dr. Fazil Show channel and add it to your home screen. View our videos online by visiting our website at www.drfazilshow.com. Our videos are available on YouTube by searching for The Dr. Fazil Show. And don't forget to subscribe to our channel. The Dr. Fazil Show is available in multiple provider office waiting rooms across Yuma, Arizona. Don't forget to get your copy of Health Tips magazine and read about this interview, currently distributed across Yuma, Arizona.
Do you agree with the testing at the airports for anybody transferring countries, international travel? Do you think that's helping us?
It depends. I mean, I think it depends on a lot of factors because if you test at the airport sites, then the test has to be accurate, has to be fast enough, so we can make a quick action about it and then a follow-up on that. But if you do the testing and the test will take 2 weeks to come back, or is a very inaccurate test, then obviously it is not going to give us the results which we are expecting. So it depends on the technology we use and how we implement the test, because as I said, one option is everybody comes and get quarantined for 2 weeks, and then if they have symptoms, they will find out. If they don't, it won't affect other people. Other option is you just have the person come in. The problem is as follows, that you come in, get tested. Now they're saying the new strain, which is UK strain and South African strain, you can get infected in 5 minutes, literally speaking. So you're walking out and you talk to somebody for 5 minutes, you have infection now. So test which was negative now could be positive. So I think we're doing as much as we can, but we cannot keep our guards down. We still have to go to the basics, mask and hand sanitization.
And Dr. Fazil, there was a lot of misinformation calling this virus a hoax in the beginning. What is your standpoint as far as a physician? Do you think this virus was a hoax, or do you think this is very serious?
So that's a very good question. I actually, initially, that's how the public was perceiving it, but they are not anymore. And the reason I can tell you, because I can tell you from my practice, most of the patients I've seen, they have somebody in their family, in their friends, in their streets, the place they live, have either been infected or died of COVID-19 infection. So at this point, pretty much nobody questioned about the existence of this COVID-19. So that hoax misinformation I think is gone. I mean, and I think that should be. I mean, you cannot protect yourself if you deny the enemy. You have to know what is the risk out there. If you close your eyes, the risk is not going to go away. It's still there. So I have seen people with COVID-19 infection. I have heard stories from the real patients. I have one patient, as a matter of fact, he was a relatively young guy, and he was living in RV. He said he got sick so fast. He's diabetic, obviously, have underlying comorbid condition, but other than that, he's in the perfect shape. So he, as a matter of fact, passed out because of infection, and he said he stayed unconscious in the RV for 3 days. Somebody found him after 3 days, and he was shipped to the hospital, and they got diagnosed with a COVID-19 infection. And he was treated for 9 days, and then he came back. Now I see him, he have a mask wrapped like, you see that in the mummies, it's like all over. And again, it's not any demographic is different than any other demographic. Is Caucasian, so this virus does not look at the skin color. It does not look at the, it doesn't look at the borders. It is everywhere. So we have to be very, very careful. I know another guy who's a police officer. landlord was found dead in the RV too. And he said, he had some infection and he didn't want to go to the hospital, and he was found dead in his RV. And so these are a few live examples. I know that there are more, but I mean these are the few important ones. And so we have to be careful. I mean, take it seriously. Don't take it as a hoax, because if we keep thinking it as a hoax, then we'll keep our guard down and it will cause more damage. So it's not hoax, it's real. And now almost everybody knows that, because pretty much everybody in their family have one or the other being either infected, sick, being in the hospital, or unfortunately died.
Somebody knows somebody.
Exactly. So since they know through direct means, so they don't care about what's misinformation on the internet or on the media. I mean, it is, and it's my job as a physician, and again, the job of this channel is to give the straight news and not the opinion, is the facts-based medicine and the fact-based news. And this is the fact. It is out there, serious, it's real.
So with our numbers in Yuma County, I've noticed that the numbers are starting to come down. Do you think that is coming down due to the vaccine? Do you think it's due to no longer testing as much? Or what do you think the cause of that is?
Well, I think a combination of things. People are getting vaccination. We know that. We have given 200 patients, up to 200 patients vaccine ourselves in our clinics, Moderna. Also, people have been more careful since now they know it's not hoax, so they're being more cautious and using social distancing and hand sanitizing and wearing masks. So I think those two factors have changed quite a bit. And then one thing I did notice, obviously, is that optimistic side of this thing is that we got less flu infection this year than in the previous years. Less cold infections than the previous years, because everybody's using masks now. So predominantly those viruses, they travel through respiratory droplets. Everybody's covering their faces with a mask. Then they're also preventing to get other infections as well. So initially we thought it's going to be a very, very bad winter, because we're going to have flu, we're going to have the blah, blah, blah.
Like a perfect storm.
Perfect storm, and defeat the logic. But it makes the logic, because, how does those infections spread? Through respiratory means. Since we have used masks a lot to protect COVID-19 infection, it also has protected the flu infection at the same time. So actually that drop didn't go up. So, we are in uncharted territory at this point. Things we think are true are not true anymore. We thought it's going to go away with the heat in the summer. It didn't. We thought it was going to get worse with winter. It didn't. So, so there's a hope at the end of the tunnel. And I think we'll overcome this epidemic with modern technology we have, and we always land on our feet, and that's what the future is, and that's what I hope. We'll pray for that.
So we do have light at the end of the tunnel. This wraps up our February 2021 edition of the Dr. Fazil Show. Thank you again, Dr. Fazil, for sharing your information with us, and thank you, viewers, for being with us, and have a wonderful rest of your day.
Thank you, our audience, for watching this show, and God bless.